Good day, dear colleagues. I'm happy to meet you today in our weekly webinars of Crystal Vision Eye Clinics by Professor Igor Aznorian. Today we will talk about phacoemulsification and about different approaches. And the topic of today's discussion is the anesthesia during the phacoemulsification. We know that during this surgery, different doctors use different techniques, and most important is to make this surgery to be comfortable for the patient. So today we will talk on the topic phacoemulsification with topical anesthesia, and I want to greet our Dr. Mohammed Ibrahim Salem, ophthalmologist from Crystal Vision Eye Clinic, who will have this talk today. If you will have any questions, please put it in the charts, and doctor will answer on them after our webinar. Thank you.
Hello and good morning, doctors. I'm Dr. Mohammed Salim from Crystal Vision Bahrain. I'm happy to share this webinar with you. Our topic today will be on phacoemulsification with topical anesthesia, precision, comfort, and innovation in modern cataract surgery. And before we talk about anesthesia in cataract surgery, we know that phacoemulsification is the most recent technique for cataract surgeries because it's using ultrasound power to distract and break up the lens. And it also has a very small wound in the cornea. So this is seems to be the long-used technique for cataract removal. Now we go to the next slide. The role of anesthesia. Anesthesia in cataract surgery plays an important role because we know that cornea and iris has a very dense plexus of nerves. This is why it is important we do anesthesia in cataract, but what was the traditional anesthesia used during the last few years? We used to do retropalpal and peripalpal anesthesia during the last few years, and most of doctors now prefer this technique because we want to stay in our comfort zone. We need the patient to be relaxed and with no mobility of the eye. So most of surgeons prefer this technique. But topical anesthesia during the last few years become the new star because it brings us a lot of good results and avoids a lot of complications. And this is what we are going to see in the next slides. So comparing topical and traditional anesthesia, to compare topical and traditional anesthesia, we are going to compare both of them in different stages or different ways in pain management for the patient, surgical time and surgical saving time, and post-operative recovery, and some topics like complications also. Patient comfort and pain scores. Topical anesthesia and local anesthesia both provides the patient a near score in visual analog scale. It's from 0 to 10. Topical anesthesia score is 2, and it is 1 for local anesthesia. So there is no much difference between both. This is why most of patients who do cataract surgery with topical anesthesia prefer to do the next eye with also topical anesthesia, the patient is already 92% of total patients went through topical anesthesia. What about surgeons? Surgeons, as I said before, uh, usually like to do cataract with local because the immobility of the eye and the stress and the we just want to be comfort when we are doing our surgery. We just don't want any more stress on us. However, there are big difference between topical and local anesthesia in everything related to the results and complications and everything related to the operation. This and we are showing this now. For the surgical efficiency of the operation, topical anesthesia time of the operation usually it takes about 10 minutes, while in peripulbar anesthesia it takes about near to the double time. It's more than 17 minutes for the operation. So the patient turnover during the operation will be like the double. So it is better to do it with topical anesthesia when you have a lot of patients. We must do it. And also for it gives us a faster recovery on logmar visual acuity on the first day after operation. The visual acuity on logmar visual score it's 0.49, while it is 0.65 with local anesthesia. What about complications? uh, from the beginning, why one of the main reasons we prefer topical anesthesia on local anesthesia is complications, because topical anesthesia eliminates all complications related to the anesthesia, especially subconjunctival hemorrhage. As we know, the main complication of a complaint of a patient under when we do a cataract surgery for him, a successful cataract surgery, what is his main complaint? He will come to you and say, I have a redness or subconjunctival, this redness in my eye. I'm afraid of it. He doesn't mention the vision. He doesn't mention the pain. He is worried only about the redness. And as we know, it's 14% of the cases with local anesthesia have subconjunctival hemorrhage. This is the simplest complication what we get from peripulbar and local anesthesia. Also, the major complications like perforation of the eye or injury of the any muscle or the optic disc, it's also complications that we need to avoid. One of other advantages is postoperative pain. Patient after topical anesthesia doesn't complain of any pain in the periocular area in his head. So while in some cases pain in the around the eye will remain with the patient for the next 2 or 3 weeks. For clinical outcomes and studies, the reports showed patient satisfaction after topical anesthesia was much more than local anesthesia. Also, as we said, complication rates, it's very low, and it's better in topical anesthesia than local. Also, recovery and visual outcomes, it's better because when you do this operation with topical anesthesia, some patients on the table of surgery, when we just put the IOL, they say, now I can see. So this is something good. It's like we are doing LASIK to this patient. So gives us a positive energy for us and the patients. So, what are the challenges for cataract with topical anesthesia? Now, this is the dark side of topical anesthesia because some patients may complain of mild discomfort during the operation. However, we put topical anesthesia, and this time, if this pain it continues, sometimes we need to add some local anesthesia. Also, patient movement during the operation. Some patients might be irritable and they move during the operation that might risk the operation. Um, and also patient education, they must be educated well during the operation, before the operation, about our steps and what we should do during the operation, and he must commit to our instructions and try to keep in his position. So what is the criteria for phaco and topical anesthesia? The criteria for phaco with topical anesthesia is very important because according to this one, we select the patients who recommend topical anesthesia for them. Patient selection is the most important thing we need to do because not everyone we are going to use topical anesthesia with him, like stressful people, cardiac people, people who looks anxious. We don't want to do topical anesthesia with this kind of people because the risk of complication will be much more with this kind. So we need someone who is relaxed, who is not nervous, who is doesn't have this tense. So this is the important thing. Also, we need to select the appropriate dose for the operation. Using the topical anesthesia, we usually use the usual Pinox or something like this to anesthetize the eye. And we must tell the patient about the movement. It is important. You should keep in your position. Your eye now is not immobile, so you need to fix your eyes in the center. Don't try to look right or left or any direction. So this is one of the patients we did cataract surgery with topical anesthesia. She had a trauma in her eyes since 2 months, 2 weeks or 3 weeks before the operation. Then she developed traumatic cataract. She came to me and we agreed to do the cataract surgery with topical anesthesia. This is just after the operation. She was happy because once we removed this cortical cataract and put the IOL, she was very happy. So we believe in the future of cataract surgery, topical anesthesia will be the standard operation uh, for cataract surgery because of many advantages related to it, uh, like the avoidance of a lot of complications related to anesthesia. Also, uh, this using topical anesthesia will lower the need to other assistance of the anesthetic doctor. You don't need to wait for the anesthetic doctor to come to you. You don't need to keep monitoring the patient during the operation. Is he good? Is he bad? Now he is feeling? Now he is not feeling? The local is good. The local is bad. There is complications related to anesthesia. So it is when the patient having any problem, it is not your fault, but you also is responsible for it because you are the surgeon. In the conclusion, we believe that topical anesthesia is a safe, efficient, and patient-friendly alternative in cataract surgery. It allows for quicker recovery and enhanced patient comfort. Phacoemulsification or topical anesthesia is a revolutionized cataract surgery by combining precision and patient-centered care. Last thing, I want to say something about this. If we check the history of cataract surgery and anesthesia in cataract surgery, there were many trials to decrease the use of anesthesia in cataract surgery. For example, in 1998, a doctor, one of the surgeon doctors, he tried to develop a technique which is called no anesthesia cataract surgery. He tried to do it without anesthesia, depending on that the periphery of the cornea is less sensitive than the center, and also the sensitivity of cornea in people live in Africa and China and countries like this is much more less than people in Western and Europe, Western countries and Europe. So he tried to invent this technique. However, it doesn't fit because it is not fit for everyone. And also, as we said, cornea is one of the most sensitive tissues in the body. So we must do both anesthesia anyway. Thank you for your listening. I hope we can share more information together in the future. And if anyone have any questions, I will be glad to listen to.